Welcome to the ATP Project. Here with your host, Steve and Jeff.
How are you today?
Mate, good. I was
feeling good?
Well, I was up until I saw all of these papers, and then I started to get a headache, mate. And getting a headache, I mean, they are the words that you never want to hear your wife speak.
Absolutely.
They're not the words that you don't want to speak as well, too, right?
We're going to get a lot of emails over that. Comment already.
Yes.
1 minute in.
I know. But, well, the interesting thing about headaches, Steve, there is a scale from 1 to 10. Actually, it goes all the way to 11.
Yes.
As if you listen to Spinal Tap. Yep. But like seriously, and we've spoken about the absolute worst end, which was, and we did some podcast recently about pain, of which cluster headaches were, I think, considered to be the worst pain that you could go through.
A scale of 9. It was on a scale of 10. They were rated at 9.7.
But today's podcast is really going to be going through everything from the mild headaches, the readers' headaches, I guess, maybe the people who get food headaches, like, if you have too much red wine,
that's
through to television, through to, all under lights, all the reasons why you get headaches, the severity of those headaches, what you're doing to trigger those headaches, what you can do to stop triggering those headaches, what you can take if you do get those headaches, the impact of modern medicine on those headaches, things like paracetamol and aspirin and, all those sorts of things as well too. So this is the complete headache migraine podcast.
And migraines are so common too. Headaches, almost everybody gets them. There's sometimes, I know you've mentioned on the podcast, you've had very, very rare headaches.
I literally, if I got one headache every couple of years, and when I get a headache, as Tony says as well too, I reckon on a scale of 1 to 10, if 10's like the cluster headache and 1's like my head has a slight feeling of discomfort, I don't think I've ever been above probably about a 2 or a 3.
So you can tolerate it mostly without medication?
I don't think I've ever taken medication for a headache. If I have, maybe once or twice, and that's because I was probably feeling pretty pedantic. But no, mate, I'm really fortunate. I'm blessed. I don't get them headaches. Even when I was younger, when I used to drink and hangovers and all the rest of it, I'd feel seedy, but I'd never get a headache. So
wow,
gee,
and alcohol's a classic trigger for those cluster headaches.
Well, again, we were mentioning things about what causes them and what can create problems. But Steve, we've been all the way to 10 on cluster headaches. Do you want to start at 1?
Yeah, we'll start low.
Okay.
There's 3 types of headaches that we can talk about. The simple headache, which is the pain in the head that's generalized. That's just like a pain that can come in all different forms. We'll get the forms. Then the classic migraines, which are different again. And when they're in little parts of the body around this, say you get a hemiplegic migraine, it's one-sided, which is weird. You get aura sometimes with them, which means you see things with a fuzz on the outside of them.
Yeah, it's weird.
Yeah, and then you get the other group of headache called like the cluster headache called the TAC headaches,
right?
Which is a type of cephalic migraine, which is really bad.
So what percentage of the population suffer from regularly? And I guess from time to time, right? If you've got an injury, you banged your head or something like that. But I'm talking about people who regularly put up with headaches. And I know the answer to what I'm about to ask you as well too, but typically females suffer from headaches more than men because they have to put up with men.
That's exactly right.
Yeah, no,
men are the causes. It's one of the leading causes of headaches is men.
Sticky blood, because obviously with the cycle and all the rest of it, Steve, the female's blood becomes more coagulated. Yeah. So therefore, obviously, that can cause part of the problem.
It's part of the problem, but also they have higher levels of estrogen, and estrogen can fluctuate. Now, estrogen is required to make serotonin. So we have estrogen, women have more of it, and women have these cycles, okay, which estrogen goes up and down. Now, the withdrawal of estrogen from a woman causes serotonin levels to go down. Now, serotonin keeps the blood vessels in your body, and particularly your head, nice and constricted and toned. When they lose the estrogen, it dilates.
Right.
Now you might go, you might have heard of hot flushes.
Yeah.
Yeah. Well, imagine that inside your cranium. The blood squashes basically the brain and all the other organs inside the head, and that's one of the classic triggers of a migraine. And that's why women get 3 times more migraines than men.
So what is the percentage? Do you have the global statistics of how many people get, not just, well, have you got breakdown stats in terms of migraines versus headaches?
Yep.
And total?
Headaches over a 12-month period, which the study I found, 86% of people have got a headache.
Wow.
In a year.
So male and female, just total population?
Total population. So it's almost everybody. you know, you got to remember, reporting a headache could be just like, or you had a few drinks, or globally.
So I'm one of the. Thank God I'm one of the 14%.
Well, yeah, that's good.
Yeah.
I mean, in the last 12 months, you haven't had a headache at all.
No.
All right, so you're one of the 14%.
Yeah.
Got to remember, headaches are caused by late nights, you know, drinking red wine, as you correctly pointed out.
I do all those things.
Yeah. And you know, even eating too much cheese, or you know,
Don't do that.
Not sleeping and stress and tension.
I have
headaches.
that.
Yeah, I know. That's right. Yeah. So you're very.
So I'm like a super person.
You're a super person. But headaches. I mean, so
I'm just fortunate. I'm very fortunate, and I do when Tony gets headaches as well too, and she gets really pissed at me.
Yeah.
Because I say, you know, you're right, sweetheart, and she's like, you asshole. You don't know what it feels like. I'm like, I don't. I can't even. I can sympathize. I can't empathize. Is that right?
Yeah.
Yeah.
What you mean.
Yeah.
Because you know the terrible
Never
headaches.
had a migraine. I couldn't imagine. Steve, you suffer from them.
Yeah, I did.
don't
I
you?
got diagnosed with cluster headaches. I don't get them bad. Yeah, I know. I
You
don't
didn't
get
tell
them
me
bad.
that.
Like, a few podcasts ago, I did.
Oh, I mustn't have been listening.
But it was,
or maybe I didn't really care.
But yeah.
No, of course I care.
No, you know, 1 in 1,000 people get those things.
I didn't know. Did you? I must have missed it.
By a neurologist. So, but the thing about
Did he say that on the podcast?
I don't know. I think.
Do you remember?
Yeah.
What was I doing? Okay.
But you got to remember there's scales of these things.
Right.
Now the only reason what I used to get, and I haven't got one for ages, is and it was this eye usually, is this eye there'd be intense pain right about there, like real focal spot, and it was like sort of round there, and you could almost feel it. You could push and feel something going, like it felt like a lump there. You felt like seriously when they got really bad. And luckily that was rare for me. You feel like you could cut it there and pull something out of your head. It was that much pressure. It was the weirdest feeling. But
well, we know people have done that in the past, Steve.
They have, actually. We're going to talk about the history of headaches. But that's exactly what it felt. And the eye would swell and water. And that's a classic cluster headache scenario. And it's very common in men, more common in men than women. So there's many reasons for that. We'll get into that. But yeah, and it's caused by this high level of this chemical in your body, which is genetically predetermined. Now, the chemical is not a bad one, like every chemical in your body. It's called calcitonin gene-related peptide. Sorry about the long word.
Sounds like calcium.
Yeah, but it's actually a peptide that causes vasodilation. And if you go through a cycle where it goes too high, then you get vasodilation in the skull, and that causes the pressure.
What we might do is we might leave the treatment or the best ways to tackle that to the end.
Yeah, we will.
So that way, you know, it's our little hook for keeping people to listen right through the
You can treat this by something you can get from the supermarket.
Oh, okay. Well, let's talk about that at the end. Right,
Yes,
now let's come all the way back
yep.
again to these little
simple headaches.
Baby headaches, simple
baby
headaches.
There's many triggers, and this is according to Mayo Clinic. The classic ones are alcohol, particularly red wine.
Sure.
Yeah. Alcohol
and is that because of the
histamine?
It's a histamine, which is from the is it salicylates or oxalates? What
all the chemicals in red wine, the tyramines and all that sort of stuff.
And what are they doing, Steve? Why specifically red wine?
Because they cause it's just super high in histamine.
Right.
It's about 2,200 millimoles per litre. That's how much it was. We recorded a podcast this a couple of days ago.
Yeah, that's right.
So I remember the
cheating.
number.
Yeah.
The white wine has 900.
Right. So significantly less.
Yeah.
Okay.
Now histamine, you might know histamine from the runny nose scenario, but histamine causes vasodilation to allow the mucus to come out of your blood and flush the toxin out. Imagine that inside your skull. Remember, there's no outlet. So you get this massive vasodilation from the histamine. And in fact, most of the drugs that prevent migraines and headaches are antihistamines.
Yes.
And so that's good and bad. We'll get to the treatments later, but as a preventative, they use antihistamines.
Okay. So if you suffer from headaches regularly and you're a wine drinker, specifically if you're a red wine drinker, you might want to rethink that.
And cheese.
Cheese. Which, and let's face it, there's nothing that goes better than red wine and cheese, right? Is there some cheeses that are worse than others, or are they all?
The aged cheeses.
So like the blue vein and the
cheddars.
cheddar. Like the cracked,
tasty,
crumbly, tasty.
Very
ones,
tasty.
Right?
The more aged.
So camembert and things like that and brie are probably on the better side.
Yeah, absolutely.
Soft cheeses.
Yeah, absolutely. They're better for this particular case. They're bad for other things too.
Yes.
But that's for another podcast. That
yes, right. Kidney stones, maybe? I'm not sure.
Basically for your brain other ways.
Oh.
Yeah.
Really?
Yeah.
Like what?
Well, it's casein and
casein, of course. Okay.
And the hard cheeses have had the casein reacted by the rennet.
Sure.
Quite, over 36 months, up to 36 months.
So there's low amounts of casein.
Yeah, and so it's been pre-digested.
But casein crosses the blood-brain barrier, Steve.
Yep.
And what does it do?
Screws with your brain, the beta endorphins in your brain, all sorts of things.
But doesn't cause for this podcast doesn't cause headaches.
No, doesn't cause headaches.
All right. So pick your poison, but that one's okay.
We're going to say they're okay for headaches, and I'm going to contradict it later and say they're bad for your body, though. But they're okay for headaches.
That's right. Okay, fine.
The other one, of
chopping
course,
off your head's good for getting rid of headaches, but bad for your life expectancy.
It's like the old treatments for headaches.
Oh well, we'll get into that in a minute.
That's beautiful.
So, all right, what
certain
else?
foods such as processed meats that contain nitrates.
Right, nitrates. Bacon.
Yes.
And bacon is huge for nitrates. And again, I think we said this before, look for nitrate-free bacon if you possibly can.
Yeah, preservative 150 is the worst.
Preservative 150.
Yeah, if you want to read the packets, if you're at the supermarket tomorrow or whatever.
All right. So mate, sitting there with what about prosciutto and some salami and some cheese and some red wine? It's just a headache waiting to happen if you got a predisposition to it.
If you're predisposed. Most people,
man, I've got to say, when my friends come over, those are the things I'm typically reaching for, Steve.
Yeah.
I love it.
And you know what? If you can tolerate them, you're going to be absolutely fine. It's just
Mind
some
you,
people.
I do, and I am really appreciating preservative-free wine, organic wine, red wine, and things like that. And actually, there's a lot of study, and I think even Ben Greenfield was saying this as well too. A glass of red wine, it's actually very beneficial for you for the most part.
Very beneficial if you can tolerate.
If you can tolerate it.
And then you got to remember,
this is why we're all different.
It is, and headaches is a real case of individual stuff.
Yeah,
it is a real individual thing.
Mind you, salamis. Typically very high in nitrates, right? So
exactly.
you don't,
So you got problems with that.
Yeah, got a problem with that.
Other things is poor sleep or changes in your sleep patterns. That can cause just your classic.
Why? Is this to do with the brain detoxification that we were sort of about?
Lymphatic system.
Lymphatic, I love it.
Yeah. If you don't clear out the toxins, so let's say you have multiple nights of lack of sleep, you will develop a headache of some descript. It'll be a dull, weirdy thing. And this is where the toxins build up there due to the lack of the lymphatic system clearing the brain.
Yep. Side sleeping.
Yep.
Lots of sleep.
Yep.
Well, when I say lots, at least 7+ hours, right?
Also, skipped meals and dysglycemia. So if you're having
dysglycemia,
so blood sugar levels going up and down, that can trigger headaches too.
Right.
Because it just your brain is highly dependent on glucose.
Yes.
And that's a problem because glucose fluctuates dramatically.
And if you're not eating glucose at all, but you're on a ketone diet, though,
oh, that's a treatment.
Oh, okay.
I'm going to get to that.
Sorry.
It's a really good treatment.
Okay, cool.
So we'll get to that. Also stress, because stress depletes serotonin. Serotonin causes, keeps the blood vessels toned. So low serotonin, you get dilation, and that can trigger headaches and or migraines.
Okay.
So really good. And
which is stress-related headache? I mean, you hear that all the time.
Tension type headache is
tension
what they call
headache, yeah.
And they, if you see the pattern of those, they go across the temples like so you'll see people doing that and squashing.
Does that help?
Yes.
It does.
Yeah.
Well, I know we're getting into treatment here because if I get anything, that's what I get. And I used to go and see this massage therapist, and he used to massage my scalp.
Yeah.
I tell you what, there's nothing I'd rather have massaged.
Really? Nothing.
Steve. This is PG.
Oh, okay. Yeah,
right?
but no,
but seriously, it was the most. I was seriously like, it was like really like areas of high stress. And I know that people go for the neck and like the sort of, the traps in that sort of area. And that's good. Yeah. The base of the spine, like the muscles up there, that's good. But mate, nothing like the side of the head. Like seriously, I was like a puppy.
Jeff, for those who aren't watching, Jeff's pointing to the above his ears, where the insertion of the mass eater is, which is a big muscle.
The mass eater.
Mass eater that closes your jaw.
I love it. I think here's my mass eater.
Yeah.
But
well, think of the big jaw you've got here, and you've got to pull it up, and so you've got to attach it to the top of your skull. Yeah. So it pulls. So you've got to contract it, and that's the mass eater. So when you're stressed, you've heard people tightening their jaw and grinding their teeth and that sort of thing. Yeah. Yeah, that's because
Tony grinds her teeth in the night sometimes.
Oh, she'd be prone to headaches.
Well, she is, and I know that's a stress response, right? Yeah. I think she actually cracked a tooth because she did it one time. Yeah.
Wow.
Yeah, she had to. Yeah. So
I'm sure he didn't annoy you before you went to bed or something.
Stop annoying her, Steve. It's not just before bed. So I think that's pretty common for most guys, right? So yes.
Oh, geez.
Yes, I'm also a very annoying person, Steve, if you haven't heard.
Oh, dear. Poor posture, that's self-explanatory, but also trauma. So that's pretty self-explanatory.
Yeah.
That's your classic headaches.
Okay.
And so that's your normal, boring type headache.
Steve-O.
Yes.
Do you know what I love about as soon as we hit like literally the day after Boxing Day going into the shops?
What's that?
It's time for Easter. Have you hot cross buns and Easter bunnies I mean, it's like 1,000 years before Easter comes. Like there's Easter stuff, right? Well, I'm jumping on the bandwagon.
See, we're going to eat chocolate, can't we?
Well, we can. And one of the funny things is that people often say coming into Easter, what I notice, and I've noticed in the industry for a very long time, is a couple of things happen.
Yes.
First thing is sales normally go down.
Oh, yeah.
And that's because the weather turns cold.
Yep.
Easter bunny comes out.
Yep.
People scarf down the Easter eggs.
Yep.
They feel bad. They stop going to the gym.
That's a problem.
It is.
Well, how do we eat chocolate, though? We've got to eat chocolate.
Steve, I think we've got to find what I call replacement therapy.
Okay.
So what I mean by that, and I'm saying it a bit tongue-in-cheek, the worst thing that you can do is see everybody around you having fun, skipping through the aisles with, Easter eggs and laughing and looking at you, and you're just sitting there miserable because you don't get your chocolate.
Yes,
you're not getting your chocolate fix. You're not having anything fun to eat. But we have provided a solution.
What is it? Tell me.
That is our marshmallow bars and our jelly bars.
Yes.
And the king of the Easter time supplements is our hot chocolate. Now, I believe we've got a limited time release of a salted caramel hot chocolate coming this Easter as well too. Now, don't shoot me because I don't know exactly when it's coming, but it's been reformulated.
Yep.
It's not quite as sweet because the other people were finding it was way too sweet. So that's coming. So keep an eye out for that. But my favorite product is the hot chocolate because you're getting good quality collagen. You're getting a little bit of chocolate in there. You can mix it up. You can have it hot at night. You can have your cocoa on the Google. No, I don't know even why I said that. That was Mrs. Euphraginian Doubtfire Lobby, right? So you can have something nice while everyone's sucking down their chocolate, getting fat. You can have your hot chocolate. You can get your no-whey protein in there. You can feel fit, fantastic, look after the sweet taste buds, and you get a nice dose of magnesium, so you'll be dropping off going sleepy bobos in no time.
The magnesium glycine. So beautiful.
You don't need to miss out. So guys, seriously, in all seriousness, obviously, if you're coming up to Easter, you don't want to blow the diet, but you're looking for something that's nice and tasty. Consider the No Way hot chocolate, potentially the new No Way hot chocolate caramel as well too, as well as maybe some of our marshmallow bars as well. So anyway, happy Easter, everyone, and hop into the store and get some today. Oh, that's terrible.
That's great.
Punny.
Very different.
Can we then address for the and I shouldn't say baby headaches, but the simple headaches, the common headache. All right. So obviously, what do they say? A pinch of prevention is better than a pound of cure.
Absolutely.
So if you are prone to headaches, avoid the red wines, avoid the bacons with nitrate, the salamis. What was the other thing you said that creates?
Oh, red wine,
cheese, salami. Yeah. So avoid those things.
Avoid those things, absolutely. But it's all about get a
massage.
Yeah, get a massage, but
especially in your scalp.
Yeah, exactly, and because that will relax you too, which is another cause. Yeah. So anything to relax you, but what's causing him?
Do you know what? What? I love my MST. He's brilliant. But I fall asleep on his table half the time.
Yeah.
And he smashes me sometimes as well too. Like my pain tolerance for that, where people they grab into the calves and all that sort of stuff. I love it. I actually I don't know what it is about it, but not when he's doing that particularly. But I fall asleep like that.
It's great because you increase serotonin when you have a massage.
Is that right?
And so serotonin is good for your blood vessels in your brain.
Yep.
Remember that? So that's a good treatment.
So you're saying that Tony should give me a massage every night before bed so I have a nice sleep.
And a foot rub.
I think she's you know what? I am highly expecting that is actually going to happen.
When this podcast come out, I think she's going to have words to me about that. But that's what the doctor
she won't, because there's no expectation that she's going to do it, Steve.
Oh, it's true, but it's true though. It's you got to remember.
Does Beck give you a nice massage?
Absolutely not.
Oh, would she give me one?
Maybe.
Okay.
More chance of giving me one.
Oh, that's disappointing then. Matt, what are you doing? You could give us massages while we're sitting here doing our podcast. But yes, okay, so a massage can certainly help.
The classic headache.
Get a trained professional. Don't rope in your significant other to do it, because it's going to be pathetic.
It never works out. But the real classic with these, if you're getting multiple headaches, you got to find out why.
Yep.
And it's not a paracetamol deficiency.
No.
It's not caused by that. Something else.
So with the common headaches, one of the first things that people would go for is the aspirin or paracetamol. Is one better than the other?
Well, it depends.
I mean, I like aspirin, but let me qualify that statement, because from white willow bark, right? It's natural. Nature knows best, and I keep saying that. And that thins the blood, my understanding is.
It does.
Any other
It depends on what's causing it. For example, if you've got a fever, say you've got colds and flus trigger migraine. I haven't talked about the secondary
migraines yet. Okay.
Headache things, but if you've got a cold and flu, paracetamol will be better. But if you've got an inflammatory headache, which most of them are, then aspirin or Nurofen, they're anti-inflammatories.
Nurofen, right.
They work against migraines. Now,
but do people still use aspirin? Because I hear Nurofen used a lot. What is Nurofen? What's
Nurofen is a type of drug that you take.
What's it called?
It's called, starts with I.
Ibuprofen?
Ibuprofen, that's right, yeah. And you take 400 milligrams of that for headaches, or if you're overseas, 800.
Yeah, Nurofen is a brand. So for our American friends, it's ibuprofen.
Yeah, I don't know what they call it in America, but
Anvil? Is it Anvil?
Oh, it could be Anvil or something. Yeah, was that paracetamol? They have weird names.
I don't know. Yeah.
But here
they're weird people.
Yeah, they are. Yeah. But here you can get Mesindol, which is a I know. It's a double one.
I had a skiing accident and I used Mesindol.
Really?
Oh yeah.
Oh, Mesinofen. Actually, that's the drug I'm thinking of.
Oh,
that's
paracetamol. I used Mesindol.
Yeah.
That's hardcore.
It's a codeine-based one, that one.
Yeah.
And it's got an antihistamine in it, so it's a very good one for headaches as well.
I wasn't taking it for a headache. I was taking it for a pretty bad injury I got from skiing. Anyway.
It's fairly strong pain. It's nowhere near as strong as some of the ones we're going to talk about.
Oh.
Yeah, but some savage ones.
For the common headache, avoid red wine, cheese, nitrate-based foods like salamis and bacon. Massage.
Sleep well.
Sleep well. Yeah. And aspirin, yes or no? Paracetamol, yes or no?
For acute. But if you're getting them regularly, you got to figure out why you're getting them.
Yeah.
So, if you've got a cold and flu and you get the sinusy headache, then paracetamol will be good with that, with antihistamine.
Paracetamol, and I know that they're talking about this as well too, paracetamol poisoning. So in terms of whenever you use medication, there's always something to be concerned about, right? Of
course, yeah.
So what does paracetamol do to is it the liver?
It's bad for the liver. Yeah, it's bad for the liver if you take too much of it.
Cirrhosis?
No. Cirrhosis of the liver.
Cirrhosis, sorry.
I was going to think, does it cause cirrhosis as well?
Sorry.
It can if you take... You shouldn't take...
I'll trample over anything,
that's
Steve.
Right.
Yeah.
You shouldn't take more than 4 grams a day. That's the upper limit.
Okay.
Now, it's tempting to take more if you've got a bad headache.
Sure.
But don't.
I did hear a study somewhere that said that when they were actually using paracetamol to determine the ability for it to reduce the symptoms and the pain, that it wasn't all that it was cracked up to be.
It's not. It's a poor painkiller.
Right.
It's only good for reducing fever. So if you've got a fever type or an infection type headache, like those sinus headaches and people are getting their fingers and pushing between their eyes like that, then it can help with that because it reduces the temperature of the body.
And again, if you've got a fever though, I always say that the body's using that to fight off infection. Yeah. Do you not want to let the fever run its course, as uncomfortable as it be? Now, I say this all the time with kids, right? Now, I understand if the kid's screaming and crying and carrying on and they've got a fever, that the first thing that mums do, and dads, and not just mums, dads as well, reach for the paracetamol to take the edge off the fever. Now that helps with sleeping, especially when teething and all the rest of it. But I don't know, Steve. Would you let it run its course? And it's really hard though, because when you see your kid in distress, you want to stop it.
Yeah. It's a 6-1, but from a black and white point of view, and it's the fever's not too bad. Like it's 38 to 39. Then you let it run its course. But don't give a child aspirin because it can cause Reye syndrome, which is, it can. in some kids you can get severe allergies and severe reaction to it, and it's a very bad illness.
And I will say as well too, and I know that we say at the beginning and or at the end of the podcast and all through the podcast, is that do not consider this to be health advice. Please talk to your healthcare practitioner. If anything is ever wrong with your little one, call the doctor, go see your healthcare practitioner, take their advice.
Absolutely.
This is for information purposes only. So having said that, Steve, because we've got to be very careful to monitor fevers always, because if they do get above 39 degrees.
Well, above 39 is a problem,
Yes, that's a problem. And you need to probably get medical intervention
and
at that
there's
point.
Great.
So in terms of those are the treatments so far for the average headache. Now, just quickly, aspirin. What does that do if you consume a lot of it? Because I've heard of aspirin being used for people with heart conditions. And
low dose.
Low dose. But what does aspirin do to the body, and how does it help a headache?
All right. It inhibits COX-1 and COX-2, so it's an anti-inflammatory. COX-2 is the inflammatory component. COX-1 is the stuff that heals your gut. Now, it just inhibits both. It's an old drug.
Okay.
And so if you inhibit the healing of your gut, you can get gastric ulceration from too much aspirin.
Right.
So that's too much.
Right.
I mean.
What's too much?
Oh, about more than 3 grams a day.
Okay.
Which is.
Do people take that?
Oh, yeah.
Oh.
Yeah, you can take super high doses for all sorts of pain conditions.
How does aspirin differ from white willow bark?
Because you acetylize aspirin.
Right. So
white willow bark is salicylic acid. And if you put an acetyl group, which is a chemical group, it stabilizes it so it doesn't go off, and you can actually then, it can sit on the shelf forever.
Okay.
So I'm preferring white willow bark.
I was going to say, milder.
It is milder.
Less side effects.
Less side effects. You don't get the ulcerations from it, so it does have less side effects. May not be as potent in some areas,
sure,
but still, it's very good.
It's a good one.
Really good one.
Okay. Anything else?
Well, just make sure your posture is okay. So you could have a chiropractic neck issue.
Sure.
Yeah, and
I got a great chiropractor. In fact, I had a couple of them. The guys down at Beenleigh, down there, and also the guys that I go see now that are closer to home. I love chiropractors. I think they're absolutely brilliant. And it's so funny because they're considered to be sort of edgy and weird, like witchcraft people. They've got an eye of newt and they're bat blood, and they're like. But mate, seriously, like the benefits for chiropractic, adjustments is brilliant.
Oh, I see Kate, my chiropractor, and she's absolutely brilliant. Helped me enormously. And she will be, it's like Braille, I guess how I describe it, is when you feel the back of the neck and you go, oh yeah, there, and she push on a bit and goes, oh, and then adjusts it and then push on again, it's gone. Now that's not placebo. I
forget, you know what, we should probably do a podcast on the benefits of osteo and chiro treatment and the science, because what's really funny is that there's they get a lot of pushback, a lot, but yet there is scientific evidence to show that it not only improves health and well-being and aches and pains, but also sporting performance.
Absolutely. It's peer-reviewed papers galore. I don't know why it's a controvery.
Why do you think it is?
Because it doesn't sound good. When you get someone's neck, you do this and it makes a cracking sound. It sounds like, looks like, you're breaking someone's neck, I guess. I don't understand it because I'm a person of science. You just look at the data.
I know, the data, right?
Yeah.
And it's funny because I think I remember sharing with people before is that Tony had, not the time I treated a foot to get her spine back into place, which is even weirder, right? Shiatsu, which you don't hear much. I don't see much of that being practiced anymore, but I think it's brilliant, that shiatsu, Japanese, form of medicine. But, she went to the doctors one time because she had a pinched nerve and they wanted to operate. They wanted to freaking operate. And she's just like, I'm going home. Went to the chiro the next day and boom, he fixed her straight up, right? So all it was a pinched nerve. And they're like, we're going to need to operate. So let's cut you open immediately.
My father-in-law, Dr. Doug, told me a very similar story.
Right.
And I'll repeat it because I won't mention names apart from Dr. Doug. He was sleeping funny on his arm. This turned out to be his arm was tingling. He got an MRI on his back. They found something and they were going to operate.
Wow.
And he just changed the way he slept. And
have you ever slept on your arm and you're woken up and the arm's like dead?
Yeah.
And you touch yourself. It's
somebody else.
It's like, well, what the hell is that cold clammy thing? It's like, it's you.
No, that happens. And
actually,
so,
Tony says that all the time.
No. What's that cold clammy thing?
Yeah, that's me.
Yeah, what was the podcast on? Headaches. That's right.
Yeah.
So I mean, but check chiropractors. It's brilliant. They really are brilliant. It beats the old type of way of treating headaches.
Yeah.
Do you want to hear some of those?
Oh, yes, and I know some of these, but I'm not going to dampen your enthusiasm, Steve.
Yeah.
Let's go for it. So,
All right.
how do they used to treat? What are we talking about? 100 years, 200 years, 500 years ago?
Well, we'll start with about 1,000 years ago.
Okay.
Yeah. And then we'll go to 100 years ago because it becomes a bit more reasonable then. But thousands of years ago, and I'm talking thousands, is you got to remember that when you get they didn't differentiate migraines or cluster headaches and that crap. You got a pain in your head.
Yep.
People would say to them, they'd say, it does feel like there's something pressure there that's pushing out of there. Now, the explanation for it was that it was a
Evil spirit. Steve, I think you've got them.
Yeah, I probably have.
Yeah. Let's drill later on.
Exactly.
Yeah.
And that's what they do. They drill a hole in your head. Now not like a hole like that, like a pin.
Yeah.
That would be like a 20-cent piece, like a dime or quarter or whatever. It'd be a large.
But I've got to ask, right? If that was the solution to the problem, then how did the evil spirit get in there in the first place?
Well,
Because there was no hole. And now that there's a hole, can evil spirits just come and go as they please?
good question.
Yeah.
But there was one in there, so they had to let it out. And you know what? The symptoms would go away.
And why would they go away?
Because there'd be less pressure in there.
Yeah.
Because the brain, there'd be pushing and then there wouldn't be.
But they'd probably die of an infection. But hey.
No, people lived.
What?
And they can tell that because you can see the skull bone healing up again in the old skeletons.
Oh, wow.
So they were healing.
Wow.
So for the body to heal, it needs to be alive. And for the amount of healing, they live for years after that. Isn't that incredible?
That is incredible.
You could drill a hole in someone's head and they could live back in the days before they knew about microbes or anything.
Gosh.
I'm sure some people died though.
I'm sure they did.
I'm sure there was a few. Slip.
Well. Next.
And, it's like the famous operations of the old days. The guy who had a mortality rate of 300% for his operation.
That's right.
Was it Linton?
Yeah, that's right. He killed not only the patient but one of the nurses and one of the doctors. And the assistant.
Someone in the front row died for a heart attack.
It's just incredible.
all within about 3 minutes, by the way.
Wow.
Oh, the patient died pretty quickly, and the assistant died of an infection, septicemia or something. Because they cut the fingers off. Because the assistant was holding the leg. No anesthetics, so you had to hold. But you got to remember, when they were drilling holes in the skull, there were no local anesthetics. But can I tell you a good treatment back then, which actually worked, is that they would get opium leaves and poultices and put them on the head. And the headache would go away.
Why?
Because opium is absorbed across the skin. Have you ever heard
what?
I know. Here we go.
Okay, no, sorry. I'm seeing.
Yeah.
Trigger warning. Yeah, sorry, go on. Wow, that's
because
cool.
nowadays modern medicine has morphine patches, and morphine is derivative of opium. So they put these poultices on the head, and the people's pain would go away.
So how do you make opium, Steve?
You just grow it.
Do you grow it?
No, I don't grow opium.
I was going to say we'll come over to your place for an opium party.
Yeah.
But my understanding is you just get poppies and then you slit them with a razor and you milk the poppy, right?
I'll be very honest, I haven't grown these illicit drugs ever.
We used to have poppies in our backyard in New Zealand.
Oh, did you?
Yeah. And I never thought to milk them.
Really?
I know. I mean, here I was doing paper runs and all the rest of it when I could have been making a fortune down at the schoolyard.
Absolute fortune.
Talk about Breaking Bad in the sixth grade, right?
well, I mean, this is what they
by the
used
way,
to
I'm absolutely joking. So
Yeah, that's right.
Yeah.
Absolutely. But there was,
I keep all of that for myself.
Yeah. So these things are still growing. They're growing in Tasmania, etc., in certain areas. I don't know what areas, and I don't care to know.
The poppies.
Yeah. And
isn't it all synthetic now?
They do make synthetic opioids, like fentanyl, for example.
My gosh. Have you heard the epidemic that's happening in
America? Yeah, it's terrible.
Do you know how many people are dying from fentanyl overdoses in America?
About 100,000 a year or something.
It's. I sometimes I look at the world and I just go, that is wrong. Like what is happening in America, the amount of people that are dying from fentanyl.
Oh, it's crazy.
Like it's just flooding into the country and we're fortunate in Australia as an island nation that we don't have epidemic proportions of fentanyl, as far as I'm aware, Matt.
Yeah.
Do you know?
I don't know. We have drugs here. We have other illicit drugs, the heroines and the cocaines.
Sure.
Fentanyl,
no.
it's usually in hospitals. Beck doles out to patients all the time.
Yeah, but then it's done through medical supervision and great, but yes.
Yeah, if you have a...
how many people a year are dying from deaths involving synthetic opioids methadone, primary fentanyl continue to rise, with over 70,000 overdose deaths reported in 2021.
Oh my God.
70,000 people.
That's nuts. That is absolutely criminal.
You'd expect that number to be about 15,000.
Yeah,
right, based on Australia.
Based on Australia, yeah.
That's terrible.
Well, they make it overseas. They ship it to Mexico. It comes across the border. That's well known.
Yeah, They've got a problem with that. It's like drug cartels utilizing mules,
absolutely.
right? Yep. That's
and fentanyl's not, as I said, it's not a bad drug. I mean, you use it for minor procedures or
petrol's useful, Steve.
Yes, exactly.
Gasoline, right?
Yeah,
so,
absolutely.
but you don't want to drink it.
No,
so it's fit for purpose, right?
Yeah, exactly.
Anyway,
terrible.
Right. So, what else, Steve-O?
All right, so that's sort of pretty much the sort of simple headachy sort of thing. We can move on to the more severe ones now, like the migraines and that sort of thing.
Let's go to migraine. So,
Migraines,
what differentiates a migraine from a headache?
All right. Migraine from a headache is different in the way, firstly, intensity. Secondly, is the location. And the third one is it's usually more common in women.
If you've got a severe headache versus a moderate migraine, what's worse?
Oh, migraine.
Migraine sounds horrible.
They can be very horrible. And also they can occur up to about 15 times a month. In fact, that's not uncommon.
Wow.
They have 15 migraines a month.
Wow.
Cluster headaches, in comparison, you can have up to 8 a day.
Oh, my.
Yeah. So
when you were getting cluster headaches, Steve, how many were you getting a day?
1 a day at the most.
Oh, my gosh.
And mine was very treatable.
How long did it go for?
They usually go for up to about 3 hours.
Oh, my gosh, Steve.
But you can treat it. And if you respond to the treatment, then you're fine. You just take
what
the
is
treatment.
the treatment?
In my case, it was triptans, which are a class of drugs.
Like a tryptophan? Like
a tryptophan. It binds to, in your brain, you remember we talked about serotonin squashing the blood vessels back down to normal? Then there's 7 different types of receptors in the brain for serotonin. And the B type, which stands for blood vessels, that's what we used to teach it to people. If you could bind, tryptans bind to that one, so it's like having serotonin. It just squashes the brain back. It doesn't make you feel any different. It just squashes the blood vessels back down. Oh. And about 50% people respond to that or more. So it's
You're in the 50% that did. Could you take high levels of tryptophan, turkey?
Yep.
Well, you wouldn't drink milk, but things that are high in tryptophan to treat it?
Absolutely, but not to treat it because it takes too long.
Prevent it.
To prevent it.
Okay.
And so that's why my cluster headaches were not that bad.
Right.
You know, but I had a few that I remember one, the worst one I've ever had, and I remember it. I was going to the top of Mount Kosciuszko.
How long ago?
Ages ago now, a few years ago, and I went to the top of Kosciuszko, and I usually carried these things around. You just, and back then I was getting maybe one every week or so. They weren't that common, or something is more common than that.
One a week's pretty common.
It's pretty common, or maybe less than that, maybe even once a month. And so I just waddled up there and felt good, and then I started getting it towards the top. So
that's just a horrible place to get it.
Yeah. So I remember walking down. Like it's about 6 kilometre walk down, which is not for you to do it, but like that's
it's rugged terrain though.
Yeah, and my eye was watering so much it was going in my mouth, and the salt, because you can't just wipe it. It was dribbling out. It comes out of one eye. It goes in your mouth. You get the taste of salt in there so bad that you throw up. But here's the weird thing: when you threw up, you actually felt better.
Oh,
because when you throw up, you squash you like that.
Vagus.
It stops the blood vessel going to the brain. So that's actually, and one of the early treatments from 100 years ago was squashing the blood vessels to the brain.
Wow.
And so if you could do that,
what could go wrong?
Throwing up, you actually felt better.
Wow.
It's the weirdest thing.
Wow.
I never let it get like that ever again. And, you just take a bloody Triptan and you suffer for a bit and, then it just goes away.
Okay.
The beautiful thing about cluster headaches, in my case, or migraines, is if they go away, it's not like you usually have no symptoms. You actually, you feel 100%.
Oh.
You go from being really bad to really good.
Okay.
Yeah, weird. It is weird shit.
So coming back to migraines.
Migraines, yeah.
So what else about migraines?
They last for about 4 hours, and they're bad, and they can be in different parts of the body. Like you can get a hemiplegic migraine, and which means half your eyes are, like half your brain hurts. Which is weird because if you've got a typical headache, it's global. It's across your head.
Yeah.
But these things can be half, or it can be at the back of the neck and that sort of thing. And you get pain like down the side of your head here. The cluster headache involves the eyeball more because there's a nerve, if you look at the anatomy, goes straight to the eye and it just triggers your eye to become swollen and red. If everyone can Google cluster headache photos, you'll see the person with it looks like they're having a stroke. Wow. It's a terrible look. But that's a real terrible. Oh, yeah, we can do it here, can't we? Yeah, good. Cluster headache, and just look for, there you go.
Yeah. Wow.
So you can see the images there. Yeah. One eye, you see the red eye, and the runny nose from one nostril. It's very weird. Yeah. And so there it is there. You see it's just from one nostril. That's the key. And you get the tearing and you get the swelling in the eye area and that sort of thing. So it's a really weird type of condition.
So what can be done for migraine, Steve? It's the same thing. What triggers them as far as food or environment?
Loads of things. A lot of nutrient deficiencies trigger migraines.
Okay.
Which is why when I started getting these things in my late sort of my 40s, I guess it was, around then, I thought, it's got to be a deficiency of something. And so I started treating this thing that I had like a migraine. And, you know, there's many, many nutritional insufficiencies that are common.
What are the most common?
All right, the most common one I found, and I've got there, is magnesium.
Yeah, right.
I know.
Calcium channel blocker.
Calcium channel blocker. And I've got a paper here, and it's titled The Role of Magnesium in Pathology of Migraine Treatment. And so what they found in these respondents is, again, that people who took magnesium, about 50% of them responded to it.
Wow.
And even transdermal magnesium, as you can see there, you can rub that on your temples and on your head and relax. Remember those tight muscles there?
Yeah, we spoke about transdermal magnesium.
Absolutely.
So that would be one of the best things that you could do?
Yeah, absolutely it is.
I mean, obviously just taking a magnesium supplement can help prevent that from coming on.
Absolutely, and that's what I was doing.
What percentage of the population would you reckon could get rid of their migraines with magnesium?
59.7%.
Wow.
How did I know that? I'm reading it in the paper.
That's great. So 60% of people, okay, well that's great because a lot of people that are listening to this podcast probably are suffering from migraines.
Oh, yeah. 18% of women suffer from it.
So 60% can be fixed by just increasing magnesium.
Yes.
Wow. Okay.
So that's incredible. Now,
what about the other 40%?
Well, see, this is the other thing. It could be another nutrient, or it could be what I do, which is misdiagnose myself.
Yeah.
Riboflavin, vitamin B2.
B2.
The one that makes your pee orange for those who are playing along at home.
Okay.
There's loads of studies on riboflavin. Now riboflavin works in the electron transfer chain inside the body. So what they've discovered since then is riboflavin, super high doses. This is drug doses, 400 milligrams a day. And what they found was that this would relieve about 40% of people with migraines, and it would lessen the severity. So
hang on, if you put those two together, that's pretty much everybody.
No, because
some overlap.
Yeah.
Ah, busted.
So yeah, it does. In the one particular study here, it was 37.5%. So that sort of thing.
So it could be a combination of things. So it's not good news. It's actually worse news.
Yeah, it's absolutely.
So you need B3 and you need B2. Sorry, and you need magnesium.
Right. And you also need another one is lipoic acid, which is lipoic acid. People found because that's in an electron transfer chain as well.
Yeah.
And that
a lot of people take alpha lipoic acid, right?
Yeah, and that's the same thing. Yeah, it's the alpha form. And that reduced a 50% reduction in severity and number of headaches in this particular study.
Okay.
So we're getting somewhere near here, aren't we?
Yeah, we are.
Yeah. So I thought, I can treat these migraine things. I'll just, didn't know it was cluster headaches, which is a totally different kettle of fish. But anyway, so we're doing pretty well. But there is the best of all. One more nutrient is coenzyme Q10.
Okay.
Break on record time, but it sounds like it's certainly an electron transfer chain. Now, this one is really good. This is a meta-analysis that was done in the British Medical Journal, and they looked at different, all the studies had to have at least 100 milligrams of ubiquinol, which is the reduced form, the active form. And what they found, you're going to love this, this is just the results. CoQ10 appears to be beneficial effects in reducing the duration and frequency of migraine attacks. So we're starting to reduce the duration. So instead of lasting 4 hours, they might last 2. And you might go, well, it's bad, but it's still better than 4. So you know what I mean? So you're starting to get a picture here that there's some energy deficiency in the brain in migraine sufferers. And so there's some, electron transfer chain block or something like that. It's not fully eluded, but it's a really good treatment for it. So if you can take CoQ10, magnesium, riboflavin, thiotic acid, these all have good evidence for the treatment of migraines.
Cool.
But the best migraine treatment, and it's probably the hardest one, is ketogenic diet.
Yeah.
That's by far the best. Now I've got a graph here.
So look, if somebody is really, really suffering,
Yeah.
they'd do this in a heartbeat, Steve.
Yeah, they would.
Like seriously.
Yeah.
Because I've heard of people having long-term issues with regards to, migraines, that it's just a regular battle.
Yeah, absolutely.
So this is something that, what was the improvement? How many people did it help?
Pretty much everybody it helped. This is what the beauty about this. And it eliminated the migraines in 60% of people. So that's pretty good.
It's very good.
Very, very good. Now, I've got a mechanistic action here, and I'll show you, but we'll put it up on the screen. You can see how it works in the body there, and it's via the gut microbiome. Look at that. Isn't that incredible? Like as I put this up on the screen, you can see there that the top one is the migraine causing inflammation, all this other crap in the brain. Then you get ketones, that's a ketone, and it reduces inflammation and reduces all the stuff in the brain. So it works in many, many areas of the brain.
It increases mitochondrial function and increases GLUT1.
Yeah.
So the two things you do want.
Yeah, which is a regular
and increases
supply.
ATP.
ATP energy. So yeah, that's what this does.
Yep.
The CoQ10s and everything. The GLUT1 is regulating the blood sugar levels.
Yep.
And reducing inflammation, of course, reduces the pain. Amazing. Basically, the number, I said 60, but it's 62.5% reduction in migraine days.
Wow.
So that's huge. So, all right, so you're starting to say, get this diet going.
Yep.
You're getting all this stuff going, and you're starting to really put a dent in it.
Yep. And what's left? Anybody fall outside?
Yeah, of course. Yep. Absolutely there is.
And what else?
There's always something you can do. Look at histamine.
Right.
And that seems to be the missing. Now, there is a drug called Migraine, which is for prevention of migraine. It's a potent antihistamine in the brain. And that's one of the most leading drugs for migraine prevention, medications. They also use valproate, which is an anti-epileptic drug. And they use propanol, which is like a beta blocker and an antihypertensive. These all reduce migraine suffering, not as much as the ketogenic diet. But here's the thing, the ketogenic diet's tough.
Yeah, it is.
There is a solution.
What's ketones?
3 grams of supplemented ketanes.
Yeah.
It works just as well as a ketogenic diet. Yes.
Get out.
Yeah. You don't lose weight on it though.
No, and this is the shenanigans, Steve.
Yeah,
and that's the nice way of saying it. In the Australians, we call it the SH housery.
Yeah.
But yeah, the shenanigans that a lot of unscrupulous marketers will put out there. Here, take these ketones and you're going to start losing weight. No, the ketones is the byproduct of kind of what you want, right?
Exactly.
But you could argue that ketones could be a way to prime the pump to get things going. But just as far as the expression in the brain, it won't make you lose weight.
No.
But if you take the ketones, it is brain fuel. So you could use it to help alleviate migraines.
It does. The studies show that. You have to use, the piper to pay is 3 grams a day. And the best form of the
magnesium salts.
Exactly.
Yep.
You got it.
Yep.
So magnesium,
Yep.
hydroxymethylbutyrate, which is the best form.
It just makes sense.
Yeah. So all right, do the diet if you're overweight, I'd say.
Sure.
Because it's going to help your body and crap.
But you know what? If you're just after the results, use that.
Yeah.
Okay.
So if you're underweight and, you use ketones, and that's what I used. And it wasn't helping me years ago. And I went, oh, this is weird. And why isn't all this stuff doing anything? And then, of course, it was cluster headaches, which is a different kettle of fish.
Okay.
I never got it as bad as some.
No.
And the neurologist, when I was talking to him, he goes, oh, you should have got this earlier in your life when you drink beer and when because alcohol is a classic. It's one of the only triggers for cluster headaches. And it's a real well-known. So, those people who, they come out of a headache and from drinking the night before, and they've got a splitting headache, and they're putting their hands over their eyes. Then that's actually could be a cluster headache trigger. Because 1 in 1,000 people get this. It's not the most uncommon thing.
Wow.
Mostly in men, age 30 to 50. Huh. So I'm going to hopefully grow out of these. Or, never getting them ever again.
Yeah, yeah.
When
was the last time you had one?
A severe one. It's a really severe one. And I had to take a medication for it, I'm trying to think, probably it was last year sometime.
Okay.
Yeah. But again, if you feel it coming on and you take a triptan, it goes away.
Right.
So there's no big deal.
Yeah.
It's just I don't want to take bloody triptans.
No.
Because they've got other side effects.
What's their pipers to pack?
It can stress your cardiovascular system.
Ah.
Now, for me, I've got a good cardiovascular system, so I don't have any side effects.
Sure.
But it's the cluster headache's the worst side effect. You got to remember when I got them, like started getting them, the only thing that helped them was you get a towel, and this is going to sound very weird, is light was your enemy.
Yeah.
So you couldn't handle light.
No, I've seen people do that, like just go into a dark room because they hate the light.
Not only a dark room, you put the, a mate of mine who is in the 4 Drive Club with me, he said, and I totally, he said, get a towel and shove it up against the cracks in the door where the light would come in, even the crack of light there. So you would be that photophobic. I used to tie a wet towel around my head and, pull it tight like a knot just to squash your head. Squashing your head felt better. Pressure on your head felt better with these sort of things. And the massage, but that sort of thing.
And then it would block out all the light too.
Yeah, it blocked out all light and it was cold and caused the vasoconstriction. The other classic treatment, which is a good one for cluster headaches, not migraines, but it may work for migraines, is oxygen supplementation.
Okay.
15 litres per minute, non-rebreather, so pure oxygen. And that causes vasoconstriction in the brain too.
Right.
So that's a nice, safe way. You go to hospital, you get your magnesium drip, which works dramatically for migraines, and you get oxygen. That's a classic treatment. Or they give you like opioids or, really terribly powerfully strong drugs. So I prefer to go to the magnesium and the oxygen.
Sure. Magnesium, oxygen, obviously trying Coenzyme Q10, alpha-lipoic acid, and could be topical, topical magnesium as well too.
Magnesium chloride.
What did you say? What was
magnesium chloride
and magnesium chloride.
Is really good, particularly in oil form.
Yep. B2.
Yeah, vitamin B2.
Yep. I think that covers a lot of it.
Lipoic acid.
I did say alpha-lipoic acid.
Oh, okay, sorry, yeah. So that's a good one, ketogenic diet.
Coenzyme Q10, yeah.
Yeah, so these are the sort of things you can do to
Shilajit's a fantastic source of Coenzyme Q10.
It is, absolutely.
In fact, if I remember correctly, Shilajit 400% more Coenzyme Q10 delivered to the cell than Coenzyme Q10.
Yes.
So, which is incredible.
Yeah.
So these bloody ancient Ayurvedic medicines, they knew what they were doing, right?
I've got some more herbs for you.
Okay.
A big table here.
Yep.
Tanacidium, or I'll just call feverfew.
I don't know that one.
Yeah, it's a old headache substance, and it's been pretty well tested.
I thought licorice was supposed to help.
Licorice does help because it increases cortisol levels, which reduces inflammation in the brain.
Right.
But also my favorite herb, I'm going to say turmeric, but my favorite herb for the treatment of migraine and for cluster headaches is a herb called Butterbur.
Never heard that one too.
It's a rare one, and it's difficult to find in Australia.
Okay. Where does it come from?
It's an English herb.
English.
So yeah, European herb.
Oh.
Butterbur. Yeah, it's quite a good one. Potassium.
Do we know how it works? Its mechanism of action.
Yes, it does. And this is where remember I said you can get it from a supermarket as well.
Yes.
There's only 2 herbs that reduce this chemical called calcitonin gene-related peptide.
Can I have a guess?
Yeah.
Wouldn't be thyme, would it?
No.
No. What?
Ginger.
Ginger. Love ginger.
Ginger and Butterbur are the 2 herbs that have been found to reduce calcitonin gene-related peptide. Now that's the king of all chemicals that you want to get rid of when you got a migraine. Yeah. If you Google headaches and calcitonin,
good old ginger. I love ginger.
Yeah,
so good.
So it's a really, really good one for getting rid of cluster headaches. And the thing is, because these herbs are quite
does it also help with normal headaches and migraines as well?
It does.
Ah,
very much so.
So what would be your top list, Steve, of things to take?
All right.
So ginger, would that be at the top?
Butterbur would probably be at the top because that's the most researched one, and ginger. They both reduce calcitonin gene-related peptide.
Okay. Alpha-lipoic acid.
Yep.
Magnesium. B2. What else? Nothing else.
I'd give feverfew.
Yeah.
Yep. Turmeric.
Yeah,
it's a good one.
I mean, you should. Yeah, everyone should be having turmeric. Anyone? Yeah.
Menthol topically, chamomile tea if it's due to stress, and lavender topically. I'm just reading the research here.
Yeah.
And certainly magnesium and the ketones.
Yep.
Okay. For
ketone salts.
Yep.
Ketone magnesium salts. Yep.
Yep. And the magnesium form of that.
Yep.
But it depends on what's causing your headache too. If you're starting to get stressed, then anything that reduces stress in your body, any of the adaptogens,
The best way I like to deal with stress is watching a funny movie.
Yeah, that sort of stuff. Because tension headaches is one of the more common headaches. I've actually got an interesting stat for you about all these global headaches. guess what? And this is not really a guess what thing, but guess what? The number one cause of absenteeism in the workplace is
Headaches.
exactly. It's the number one cause. It's way at the top.
Yeah.
That's why people are absent from work. Migraine and tension type headaches are the two dominant primary headaches disorders that are common and the most lost work time. Isn't that incredible?
It is.
It's like that is the enemy of production.
What about we were talking about putting citrus aurantium oil?
Yeah.
Would that help?
That'll help because that will help with the energy systems in the brain. So you know, you've got to think of this as a global problem.
Because I was thinking, right, what we need to do is I was going to bring in amphetamines for all the workers, but I was thinking probably citrus aurantium is probably better and more legal.
A little bit more legal, but you know, I reckon amphetamines, that'd be great. You get stuff done.
And then look, you'd lose the occasional worker to an overdose, but hey,
they become addicted.
It's a price we're prepared.
They would become addicted to coming to work. They come on Saturday and Sunday.
Here we go, like little. Here we go. Here's your ration. No, you've got back in the line twice.
Yep. I'd put it in the water. Now you're thinking because everyone drinks water. Oh, we're going to be kicked off for this one, aren't we?
No.
Yeah.
No, we're only joking. We wouldn't do that.
Of course we are. Absolutely only joking. So it's a real tricky one, this one. You know, the whole migraine thing. The most important thing in the lesson for me is get properly diagnosed.
Sure.
You know,
so you can have a look at your chiros. You can have a look at your massage therapist can potentially help as well too. If it's structural or if it's muscular tension. We've given all those herbs and other things people can take, the foods to avoid, Steve. I think we've covered pretty good ground. Is there anything that you want to talk about in finishing?
They're just some of the newer drugs that are out. I mean, so this is, you know.
Acute treatment, if you're really in trouble, go see your doctor, of course.
Yeah, and then you can get things called triptans.
Right.
Which have been around for 20 years. They're relatively safe, but if you've got a migraine or a cluster headache.
Yeah, go see a doctor. Seriously.
Go
get some pain med.
Interesting, there's a triptan called rizatriptan, which dissolves in your mouth. Rizatriptan, yeah. And dissolves in your mouth, so it works very, very quick. And this is actually, you can get it from a pharmacy now without a prescription. You get one tablet.
Wow.
Because there's so much of an emergency.
Yeah.
If you've got a headache and you're out in the shopping centre.
Really?
Yeah.
Well, that's really good to know. Because I understand that, that especially if you're migraines and cluster headaches, that people, it can become unbearable.
Yeah.
Let's put it that way.
Now, for me, they work like a miracle, but
60% of people, you said, right?
Yeah, but for 60% of people, and so they did an experiment. They measured that calcitonin gene-related peptide in the saliva, and all the people that responded to rizatriptan, or any triptan, let's just say that rizatriptan was the one they tested, they had elevated levels of calcitonin gene-related peptide.
Wow.
So if you respond to triptan, the Butterbur and ginger would be your herbs of choice.
Yeah, good on you, Steve.
And that's where you should be aiming your treatment at.
So you could go and get this tested. If you've got a problem, you could potentially go and test for...
Oh, calcitonin gene-related peptide.
Right.
You can't test that in the blood.
Oh, so how do you test it? Only saliva?
Saliva, but it's only in universities. It still hasn't been... Oh, no, it's stupid. It's stupid. This chemical's normal in your body, but...
So 60% of the time, though, from what you're saying, is that probably is the problem. So better odds than not, maybe give the ginger and the Butterbur, Butterbur a go.
And you can get them in combination. There's lots seen around. There's lots of formulas for those two things. You know, well, we don't sell it just for, but you can get it from loads and loads of places. And you can get the one that's standardized too, the Butterbur standardized, and that works extraordinarily well. Okay. Now there is a drug called Emgality, which is an injection that's a monoclonal antibody. It's getting a bit techo that binds the calcitonin gene and drops it.
Right.
And that's a new preventative. Okay. Brand new preventative and all that.
It's a drug, is it?
It's a drug.
Okay.
Yeah.
What's the piper to pay?
Oh, you don't want too lower levels of calcitonin gene-related peptide. So if you
what happens if you get too low?
Then you can get severe lung infections from a virus that shall not be mentioned.
Oh, okay.
You know that one?
Yep.
Yeah. The calcitonin gene-related.
But I mean, even if that wasn't around, you're still pneumonia and other things like that.
Yeah, exactly.
Right? So
because it causes, if you don't get enough blood, like if you just take it and you don't need it, you will get vasoconstriction throughout your body. Yeah. And you will get problems. You know, that's like all sorts of things.
So with people with cluster headaches and all the rest of it, should they avoid things like citrulline and other things like that as well too?
The interesting about cluster headaches is not as well researched and they don't know what triggers it. Migraines,
you should avoid citrulines and anything that's that increases nitric oxide production, right?
Correct. Absolutely. It can.
It can.
You know, again, most people take this stuff and it's
This
fine.
is where people, I remember a friend of mine, he got migraines from eating chocolate. So he couldn't eat chocolate. Yeah. The same thing he would have been the same thing when he got older with red wine and cheese as well too, I'm sure.
Well, chocolate's got theobromine. It could be that's vasoactive in the brain. So, but again, it's like if you can tolerate it,
you don't know.
One man's food's another man's poison. And it really is
saying.
the classic saying with migraines, cluster headaches and headaches. It's different things for different people.
Steve-O, thank you. I think that's given people some food for thought, and I think there's some opportunity there to talk with your healthcare practitioner.
Absolutely.
As always, guys, if you've got any questions, please write in. Steve's happy to answer some of your questions. And if you're watching on YouTube, please, if you can hit the like and subscribe, we'd appreciate that. Share this with your friends, especially anybody that you know that's having problems with headaches or migraines. We'd really appreciate that. FAQs.
Let's do it.
Let's do it. Steve-O.
Yes.
Give me that.
Oh, okay.
I'll read this.
I'll get that.
Yeah.
That's good.
You're the smart one. I'm the pretty one. Just remember that, right?
Don't know about that.
So, yeah.
I haven't even read these.
All righty. Here we go.
Okay.
I've been listening forever and a day to you guys. Forever and a day.
Oh, forever and a day.
Okay, let me read this again. Now you can tell that Steve definitely has the brains and I'm the looks. I've been listening forever and a day to you guys. Absolutely love the show. Conversations have helped me with my own lady issues, PCOS, which I have now managed to control. I've been doing a little bit of reading beyond and have come across the Dutch test. We've spoken about this before, Steve. Yeah. Have you had any experience with the Dutch test? Are there any recommended naturopaths to see for this test in Australia? And would it be worth my while having it done? I'm in my late 30s, quite fit, active, petite build, but obviously suffering from PCOS. Steve-O, and I will rule myself out of this conversation because I appreciate this is health advice. And again, this is general advice only. Please go and speak to your healthcare practitioner. But Steve, where could this lady start? What are some of your understandings? We have spoken about the Dutch test. So.
Yes. It's a great test for actual global hormonal levels in the body, because if you do an instant one, then it tells you where you are at the moment. But if you do a 24-hour urine collection one, like the Dutch test ones, then it gives you a much more accurate global level of your hormones. Now, for somebody who's 30 and you've got quite healthy and you've been diagnosed with PCOS, which is polycystic ovarian disease, and you've already got that under control, you may not need a Dutch test because you may have your hormones under control. However, if you want to get one, then you go to a natural practitioner that has Dutch testing in their arsenal.
Steve-O, what about Nicole and Danielle that used to work with us?
Absolutely.
Now, I know Elizabeth does do them, but I don't think Elizabeth's practicing anymore. Is she?
I think she's still got a website up because I referred someone to her the other day.
Oh, okay.
Yeah. So, she's great.
So what I recommend is that Nicole, Danielle, or Elizabeth, who have worked with us, and again, we love these guys. They're very, very talented. Maybe the best thing to do is to email us at info@atpscience.com and we could pass on that referral to them and they could help you with the Dutch test if that's something that you're after.
Absolutely.
Steve, any other advice here?
No. I mean, I like the fact that she's fit because activity is great for PCOS. Being active and petite build, so she's lean, that's extraordinarily important for anyone with PCOS.
Yep.
And keeping on a low carbohydrate diet would be the first thing you could consider.
It's insulin, correct,
It is
Steve?
insulin.
Yeah.
And so cinnamons and chromiums, those sorts of things will help as well.
Yeah. So what we might do, if you can reach out to us on info, ask for those details, we can send them to you. And we're also going to send you out a little thank you. And we're going to give you a product from our repertoire as well too that might be beneficial, Steve.
Absolutely, it will be.
Yeah, you know which one I'm thinking
of.
Yep,
I think I know the one you're thinking of.
All right. Secret squirrel business.
Yes.
We can tell you.
Can't say.
Yeah, we can't say it. All right. So thank you so much for writing, and we really appreciate that. And hopefully we can support you and get some help for you. And that's the nice thing is that we're going to recommend you to a professional that can actually treat you as an individual. And it's really important. I'm just saying this as well too. Whenever Steve and I are talking, and I'm not qualified, so I'll always ask the questions. But even with Steve as well too, even though he is qualified to give advice, it needs to be personalised. This general information, just like we spoke about on the headaches, there can be many, many different reasons. And unless you've got somebody who's individually, looking at you as an individual, that advice might not be right for you, which is where you need to take this information to your healthcare practitioner. Sorry to belabor on about that, but it's really important. Okay. Here's another one, Steve-O.
Yes.
On alkalinity from water, Does a baking soda water solution before a big workout actually help to reduce lactic acid buildup during resistance training? Now,
Yep.
I am going to say something here, not as advice, but as an observation. There was a 400-meter runner in the United States who used to take baking soda before he'd run to buffer lactic acid. Do you remember who that guy was, Steve-O? He was really famous back in, I think, the 90s.
Oh, Linford Christie?
No, he was around the same time.
Oh, okay.
But he used to have a very upright, it was an American guy. Yeah, really upright.
Right.
Forget his name. Matt, can you have a look and see if you can find him? 400-meter runner, baking soda, upright run. See if you can find someone. He was an Olympian, great runner. He used to use baking soda, right? Now, Steve, I know too much baking soda can give you the squirts, right?
Yes.
So this whole thing around acidity and buffering acid and all the rest of it, alkaline water, we actually mentioned this recently as well too. Stomach is a pit of hydrochloric acid. You want it to be acidic to help break things down.
Yep. You
don't want acid, or you want to buffer acid in the bloodstream attaching to muscles, but you do want acid in the gut.
Yeah.
So this is where, and again, Steve, I'm just making observation.
Sure. Yeah.
This is where things, if you're really interested before a big workout at buffering lactic acid, Steve, what I would look at, and again, you're the expert, so you correct me. I'd absolutely be looking at your electrolytes.
Yeah.
I'd absolutely be looking at your Krebs cycle. I'd be looking at things more than anything else, like beta-alanine, which helps with your H+ ions, which absolutely buffer acid and the effects of lactic acid on the muscle, which causes the muscle to go spastic. I would not be using baking soda. No. I think that the benefits of that would be relatively minor.
That they are. That does help.
It does help.
But it's an old style. It was taught to us in the 90s before beta-alanine was a supplement. And what it does is you take such a large dose that it sort of gets through the stomach area, and sometimes and of course you imagine all the sodium.
Yeah.
You know, in sodium bicarbonate.
Oh, yeah, right.
And so you're getting a whole dose of salt.
Which is good, but not too much.
Well, yeah, the amount they were taking like tablespoons.
Yeah.
And that causes dehydration. So people were doing it and going on long events and dying of dehydration.
Wow.
So it was kind of like, we won't be doing that anymore.
Too much of a good thing again.
400 metres, the runner won't dehydrate in 400 metres because that's only, 40 seconds or whatever the hell it is. 40 so less than 40 seconds. But you got to remember, before a big workout, a lot of people sweat. And so you can dehydrate yourself and cause electrolyte imbalances and also make you feel nauseous in the stomach. So beta-alanine doesn't.
Thank you so much for writing in. As I said, I love these questions. I can see that people are trying to biohack and find ways to improve their performance, and that's what I love it. And it's funny because people said the other day, what does ATP really want? And look, we believe in the father of modern medicine. That is that all health starts in the gut, and that let medicine be your food and food be your medicine. The interesting thing is that every expression of everything that we do is around that, the education, the information. When we were talking about supplements and ingredients that we don't even make or sell, Steve. So we care about people and trying to get the best results possible. But look, if you can start off by looking after the gut, then you can look at health and wellness, and you can also look at performance as well too. And I guess that's what I love working with athletes. But I also love working with people that are trying to improve their health and wellness as well too.
Absolutely.
And sometimes those things intersect. But in the middle, nature knows best.
It does.
And this is where the gut is so important as well too. So
always does.
Yep. Yeah. Anyway, thank you so much for writing in, and thank you, Steve, for the podcast. That was really interesting.
Good fun.
And we'll be back with more
next week.
Steve.
Yes.
Time for Australiana. I always feel like we need a little intro, Steve-O.
I love this bit.
I'll go first, and then you've got one. I've got one for you.
Yeah.
Now, this is interesting. This is sort of a. I've got two for you that sound good, but actually aren't.
Don't give me any clues.
All right. So, mate, if I said, "Good on you, Steve,"
that's the way you say it.
Good on you.
Yeah.
What does that mean?
That means I've done something stupid or bad.
Yep.
Yeah.
Yeah. Yeah. Especially, good on you, mate.
Yeah.
And this is the thing I love about mate.
Yeah.
It can
add it to anything.
Go, mate.
Yeah.
It can be an expression of oh my gosh.
Yes.
It can be excited to see you.
Yep.
Mate.
Yes.
But good on ya.
Yeah.
Good on ya. So that means, dickhead. Right. I'll give you another one as well, too.
Another one.
Okay. It's Australiana.
Yeah.
It starts with C. It is very derogatory.
Uh-oh.
But it doesn't end with the Northern Territory.
Yes.
Yep. Champ.
All right.
Now this is funny. So this is where there's an evolution even in Australia.
Yeah.
But one thing you don't want to call an Australian is champ. And you don't want to say, good on you, champ. So Americans are like, well, that sounds very nice. Good on you, champion.
In mathematics, 2 positives still positive, but in this case, 2 positives, good on you, champ is a negative.
Oh, yeah.
Yeah.
Yeah. Good on you, champy. Eh? So, you just don't say to an Australian, good on you, champ.
In maths, 2 negatives make a positive.
Yeah. Well, do they? I don't know. It just sounds very negative to me. Anyway, Steve-O, what do you got?
All right. What do you got for Smoko?
Well, I've got some, maybe an apple. If I'm Australian, I've probably got a sausage roll and an iced coffee.
But the word Smoko.
Oh, right, Smoko.
Yeah.
It's like a morning tea or afternoon tea.
Yeah.
Yeah, Smoko.
I don't think the Americans call it Smoko.
Don't they?
Don't think so.
No.
It's probably an Aussie word.
Yeah. Actually, I don't hear Smoko used too much anymore because I was only saying to Tony the other day, it was Smoko because it was a smoke break.
Yeah.
But most of the time, that would be the time you'd have mid-morning or mid-afternoon tea where you'd pull something out of your lunchbox.
Or you would.
Or you go to the Smoko van.
Smoke a dart.
Smoke a dart. A darb.
Yeah, or dart.
A durry.
Durry or dart.
Yeah. Cigarette. Yeah.
I know. It's crazy, isn't it?
Yeah, it's funny.
But, there's a few other. I'll give you one more quick one.
Yeah.
Don't get your knickers in the knot.
No, don't get upset.
Exactly.
Yeah.
Yeah, it's easy, isn't it? It's weird stuff.
But is that? But other people would know that one, wouldn't they?
I don't know.
Oh, yeah, because Americans say don't get your panties. I love Americans when they say, we say, yep, I'm just going to throw my thong on and go down the beach. Now, mind you, actually, I don't know if you've been down the beach recently, but that's all people wear is G-strings.
Yes.
So thong in America is G-string hero. Oh my gosh, Steve, you got to stop that. It's not right for a 50-year-old man to be wearing his G-string down the beach.
53 actually, so I can wear.
It's disgusting.
Oh.